Hello, my name is Lydia Nganga. I am a student in the chaplaincy program at DTS, and I will be presenting my findings on healthcare chaplain. What is a healthcare chaplain? A healthcare chaplain is one that offers their services of spiritual care, or what is sometimes called pastoral care, within the healthcare setting. Healthcare settings can be hospitals, which are inpatient facilities, or they can be outpatient facilities, retirement communities that include assisted and independent living, hospice, home health, palliative care, as well as funeral homes. Their services are not only targeted to the patients, but also their families and also the staff that work in these institutions. The skills and education requirement by most institutions for chaplains, if you're going to be working for a healthcare institution as a full-time chaplain or a staff chaplain, most of them would require you to have a master's in divinity or an related equivalent field. You would also need to have completed 1,600 hours of clinical pastoral education. This can be done through internships or residency programs. Part-time chaplains who work in healthcare settings are only required 400 hours of these clinical pastoral education hours. Some of the special skills that chaplains would need as they minister to their clients in the hospital setting, like I said, this would be patients or their families or even the staff members, would be a skill of being able to articulate themselves in a loving, caring manner, being empathetic to what their client is going through. They also have to practice good listening skills. Sometimes just the ministry of presence is what is needed. Sometimes they just need to be there. Another thing that they have to be is open-minded as you serve people of diverse cultures and religious beliefs. Other skills that chaplains would need, of course, would be how to use computers, faxes, because a lot of times you would be required to do assessments and you need to be able to enter that data into the computer. Specific training programs and certifications that chaplains would need. The chaplain would need, of course, to either have some sort of pastoral experience, like I said earlier, Master of Divinity or a related field. Depending on the institution, you would require 2 to 5 years of that kind of experience. You'd also need to get accreditation and certification from the Association of Professional Chaplains, which is called APC. And this can be, those hours can be gotten, like I said, through your internship or residency programs that would be equivalent of what is needed to get your certification. Organizations that support hospital or healthcare chaplaincies, like here in Texas, we have the Baylor Health System that supports and believes a lot in spiritual care for the patients and staff. Another organization that deals with accreditation and accountability as well as training is a Joint Commission of the Accreditation of Healthcare Organizations, which is also known as JCO. Like I said earlier, ACP, the Association of Professional Chaplains, is also one that offers certification, accountability, and accreditation for chaplains. How is the work of a chaplain distinctive from that one of a congregational chaplain or a congregational pastor? The chaplain is in a unique position to be able to minister or to offer services to family, to patients, and to staff members in the health setting. And this gives them the opportunity to serve people of diverse cultures, different faiths. Healthcare chaplains or spiritual care within the healthcare setting is very important for patients. One, because Most patients, when they receive grave news, need spiritual care. The presence of a chaplain within that healthcare setting offers a unique opportunity for the chaplain to be able to offer comfort to patients and the family and even staff. Another thing, as we have seen during this season of COVID, is a lot of patients and family members were isolated from each other and even staff. And the chaplain is in a unique position to offer comfort, to offer presence, to be there for these staff members and their families. Another reason why spiritual care is very important in the healthcare setting, and that is unique from other settings, is that when somebody is terminally ill, a chaplain is in a unique position to be able to talk through rites of preparation for burial, preparation of different rituals that will need to be done in preparation for a loved one to be laid to rest. The chaplains also are able to talk to patients about, certain, depending of course on their training, certain treatments that are needed that they may not understand, and are also advocates for patients and their families. For instance, Jehovah Witnesses do not believe in receiving blood, and a chaplain can be an advocate for a patient and their family if they have not been able to express this religious belief to the doctors, and that way they receive the care that they need. Also, chaplains are in a unique environment in the hospitals or healthcare settings where they are able to pray or offer prayers, or refer patients and their families to rabbis or imams that would be needed to support them for spiritual care. For myself, I have an example of where I worked in a hospital. I am a trained registered nurse, and I had a patient who was of Hindu faith, and this patient was having a lot of pain, and I was assigned to him for the night, and we had given him every medication that we could give him that would not kill him to manage his pain. And as I spoke with him, I realized that this man also had his wife in the maternity ward, and she was in active labor. And over and above his physical pain, he was also in a lot of emotional pain that he was going to miss the birth of his child. And so as we talked, I was in that unique place of where I was able to offer him comfort and just be there. And when we talked about all the opportunities we had, and had given him medication, and we could not give him any more at that time, I asked him if he was okay with me praying to my God, and he said yes. And we prayed, and it is a miracle that happened after that. His pain was gone, and not only did his pain go away, the man was able to witness the birth of his child. So this happened while I was working as an RN in the hospital. But if I was a chaplain, that would have offered me a unique opportunity to minister to this patient and his family. Methods of self-care that chaplains need would be to get adequate rest, being in an accountability group, either with fellow chaplains or people who share their same values, and also to set apart a lot of time for prayer and reflection. As you know, chaplains are always giving of themselves. It's important for them to be able to care for themselves in order to care for others. Some of the ministry boundaries that chaplains have in the healthcare setting would be the idea of separation of church and, government. The chaplain has to always be able to recognize that tension and be aware not to overstep what the patient and their family believe, but to offer service to them that is respectful to them regardless of their faith. Another boundary would be, of course, that a chaplain has to be aware not to postulate the patient and their families or the staff that they're ministering to and convert them to their faith. You're there to support them and offer service, religious service for whatever needs that they may have at that time. Potential legal and moral issues that healthcare chaplains would run into, of course, like I said, would be legal suits. You know, if somebody feels that you are pushing them to believe something they don't, they can sue you. Another thing would be patient privacy. You know, the HIPAA laws that are there. Chaplains have to always wrestle with that tension of how much to share, and keep the patient information safe and private. Other moral issues that a chaplain may run to, say if they're in a board of determining who receives a transplant, those can be some moral issues about things to do with mercy killing or euthanasia, abortion, social injustice, or abuse, and even things like patients who are hurting deeply, either they are grieving, or like in this COVID situation, the nurses, and those who are serving these patients were also grieving with, the patient and their family. So chaplains, those are things that they have to always deal with. And so you always have to be aware of what the moral implications of what you say and do are. Current trends as of today in a healthcare setting is that I believe the chaplain has a unique opportunity and position in a healthcare setting. They are able to offer one-on-one care. They're able to offer the ministry of presence, and they are there a lot of times when the patients and the family and the staff need them, and they are able to offer service to them without the hindrance of what their faith is. So however, even as a chaplain does this, they still have to be constantly aware of what their limits are and what they can offer that will help this patient. And so I hope I have given you some insights on what the scope of practice of a healthcare chaplain is. And come and join me. Thank you.